Statins. Who should take them? My name's Priya and I'm a pharmacology student at Nottingham Trent University, here to inform you about statins. You may have already heard about statins, but if not, here's a video to explain what they are, how they work and who should take them. Heart disease is a leading cause of death worldwide, with strokes coming in second. Both of these are types of cardiovascular diseases which our healthcare system sees as a priority to prevent and treat. So how can cardiovascular disease be prevented? It's important to exercise and maintain a healthy body weight and diet, as well as reducing or removing lifestyle choices such as smoking and drinking alcohol. But even if after making lifestyle improvements you're still at risk for developing cardiovascular disease, your doctor may prescribe a class of drugs called statins. Now, you may be wondering, what actually are statins? Statins are a type of medicine which help to reduce the amount of low-density lipoprotein, also known as bad cholesterol, in the blood. They also prevent LDL cholesterol from being produced in the liver. So you may be asking yourself, what is LDL cholesterol, and how do statins decrease LDL cholesterol, and why does that reduce the risk of cardiovascular disease? Let's take a look at some background information to help understand statins better. To begin with, in humans, cholesterol is a natural substance in the body that is produced in the liver. It's essential in the body for cells to work. It produces hormones and is needed to make vitamin D, as well as helping with absorption and digestion of fats. Cholesterol is not soluble in the blood, so it must be transported through the blood in special particles called low-density lipoprotein particles. When cholesterol is in these LDL particles, it's referred to as LDL cholesterol. Cholesterol is needed for bodily functions, but too much of it can cause damage to the body and lead to cardiovascular health issues. How does having too much cholesterol lead to cardiovascular disease? Damage to vessels from high blood pressure, increased fats and cholesterol in blood, high blood sugar from diabetes, or toxins from smoking can lead to the occurrence of an inflammatory response causing plaque to develop on the inside of the blood vessel wall. Plaque is a buildup of LDL cholesterol, other fats, and dead immune cells, and is covered by a layer of smooth muscle cells. Plaques are dangerous because they can rupture, causing blood clots to form, which lead to the blockage of blood vessels. A heart attack occurs when blood vessels are blocked by this process, because blood cannot travel to the heart, which means it doesn't receive oxygen or nutrients, causing it to function abnormally, fatally shutting down the body. This blockage can also happen in blood vessels within the brain, causing strokes, brain damage, or even death. The main component of plaques is LDL cholesterol, the bad cholesterol. Therefore, statins have been developed by pharmaceutical companies to reduce LDL cholesterol to prevent plaque formation and eventually reduce the risk of cardiovascular disease. So why are statins so effective in reducing LDL cholesterol? To understand how statins work, firstly we must need to understand how cholesterol is made in the body. The formation of cholesterol involves multiple steps, but the most important stage is the development of mevalonate from a molecule called HMG-CoA. HMG-CoA contains coenzyme A, which is removed to form mevalonate. The removal of coenzyme A is carried out by an enzyme called HMG-CoA reductase. Statins can also bind to this enzyme because statins and HMG-CoA both have similar chemical structures. However, if a statin is occupying the binding site on the enzyme, then HMG-CoA cannot bind, meaning no mevalonate can be formed because no reaction has occurred. This is how statins stop the production of cholesterol. So how does stopping the production of cholesterol reduce the amount of LDL cholesterol in the blood? By stopping the production of cholesterol, the body looks for other sources of cholesterol to carry out basic bodily functions. The other major source of cholesterol is in the blood, packaged as LDL cholesterol. The liver adapts to remove LDL cholesterol particles from the blood and breaks them down to reabsorb the cholesterol from inside these particles so that it can be used. What are the side effects of statins? Like with any drug, statins have side effects too. These include headaches, stomach ache, increased risk of diabetes, insomnia, and muscle and joint pain. Muscle and joint pain is caused by damaged muscle tissue, which can lead to myopathy. If you are taking statins and experiencing side effects, you should go see your doctor. There are 3 types of statins available. They differ by how much cholesterol they reduce. Low-intensity statins are usually enough for most people in reducing LDL cholesterol levels. The effectiveness of these statins depends on which dose is prescribed. To find out who should and shouldn't take statins and alternative medications instead of statins, watch part 2 of this video.